Bismillah ar-Rahman ar-Rahim. Recommended treatment regimens for TB in children. The WHO recommends the following dosages of anti-tuberculous medicines for the treatment of tuberculosis in children. Isoniazid H 10 mg per kg. The range is 10 to 15 mg per kg and the maximum dose is 300 mg per day. Rifampicin R 15 mg per kg. The range is 10 to 20 mg per kg. Maximum dose 600 mg per day. Pyrazinamide Z 35 mg per kg, 30 to 40 mg per kg. Ethambutol E 20 mg per kg, 15 to 25 mg per kg. Children with suspected or confirmed pulmonary tuberculosis or tuberculosis peripheral lymphadenitis who live in settings with low HIV prevalence or low resistance to isoniazid, and the children who are HIV negative can be treated with a 3-drug regimen HRZ for 2 months, followed by a 2-drug HR regimen for 4 months. Infants aged 3 or equal to 3 months with suspected or confirmed pulmonary tuberculosis or tuberculosis peripheral lymphadenitis should be promptly treated with the standard treatment regimen. Treatment may require dose adjustment to manage the effect of age and the possible toxicity in young infants. Streptomycin should not be used as part of first-line treatment regimen for children with pulmonary tuberculosis or tuberculosis peripheral lymphadenitis, and the children with tuberculosis meningitis should be treated with a 4-drug regimen HRZE for 2 months, followed by a 2-drug regimen HR for 10 months. The total duration of treatment being 12 months. The doses recommended for the treatment of the tuberculosis meningitis are the same as those described for pulmonary tuberculosis. The children with osteoarticular tuberculosis should be treated with a 4-drug regimen HRZE for 2 months, followed by a 2-drug regimen HR for 10 months, the total duration of treatment being 12 months. The doses recommended for the treatment of osteoarticular tuberculosis are the same as those described for pulmonary tuberculosis. The children with pulmonary tuberculosis or tuberculosis meningitis caused by multiple drug-resistant bacilli can be treated with a fluoroquinolone in the context of MDR TB control program and with an appropriate MDR TB regimen. The decision to treat should be taken by clinicians experienced in managing and pediatric tuberculosis. Corticosteroids. Corticosteroids may be used for the management of some complicated forms of TB, such as TB meningitis, complications of airway obstruction by TB lymph glands, and pericardial TB. The drug most frequently used is prednisolone in a dosage of 2 mg per kg daily, increased up to 4 mg per kg daily in the case of the most seriously ill children, with a maximum dosage of 60 mg per day for 4 weeks. The dose should then be gradually reduced tapered over 1 to 2 weeks before stopping. Conditions indicate hospitalizations include TB meningitis and Miller TB, preferably for at least the first 2 months, respiratory distress, spinal TB, and the several adverse events such as clinical signs of hepatic toxicity, such as jaundice.